Jordana Murby. I am the Shelter Support Director for American Pets Alive and the former Maddie's Medical Program Advisor. And this is an introduction to Maddie's Shelter Clinic Management course that will be starting soon. And so this is just kind of like a background, quick overview of the things that we'll be talking about. Yeah, I'm very excited to meet everybody very soon. We do have a philosophy of life-saving at Austin Pets Alive. Our goal is to save the life of as many animals as possible and give every animal a chance at life from whatever it is that they're coming through. Sometimes it's just there's no space for them, or sometimes they've been through a medical emergency or episode. And we recognize that each animal is an individual as well. We firmly believe that suffering can be temporary, much like with people. If something were to happen to us, if we were to be in a car accident, we would be taken to the hospital. We may be suffering and in pain, but we would be given proper care. And then we would hopefully get through that suffering and go on with our lives. And so animals are much the same. Whatever it is that they're going through right now, we want to get them on their road to recovery, treat their pain, treat their ailments, and get them into forever homes. And so we don't assume that recovery isn't possible. We actually assume that every animal is going to recover, and we treat them as such. Opinions do matter. And so we make a lot of decisions as a team, including sometimes life or death decisions. So it's not just up to any one single person to decide if an animal is going to be euthanized, or if it's, there's a quality of life decision to be made. We ask stakeholders, and that can be just, that can often look like one other person, or it can look like two other people, or sometimes three other people. Whoever is invested in that animal's life gets to kind of have a say. And so it takes the burden off of any one person that is making that decision. And it also allows for just a sharing of information and perspective. We can get other people's perspective to make some of these really tough decisions. And again, sometimes it's just one other person. Sometimes it might be multiple people. We do want to focus on practical solutions to problems that are in front of us, not impractical solutions. The best comparison that I can have is we just need a new shelter. That is not a practical or immediate solution. And so while yes, we want to be working on some of those things as an organization, perhaps, that's not what we should be focused on in our day-to-day in the shelter. And so we really want to look at practical solutions. What can we do today, tomorrow, the next day, next week to solve this problem? Our priority, again, is to save as many lives as possible. And so our goal, it sounds kind of funny when I say this out loud, but our goal is not to provide gold standard medical care, because we know that when we do that, our resources dwindle, and that allows for life-saving of fewer animals, while other animals are left behind. And so we'll get into this a little bit later as well, but we really strive to be the average pet owner of average means. And while we're responsible for the care of these animals. And so gold standard is not our goal at Austin Pets Alive. Hopefully it can be someday when Texas has come to, not euthanizing animals, but that's a little bit impractical. At least in the next decade. We have to make our mission affordable. The price tag of euthanasia is very, very low. We're talking dollars. And so saving animals costs more than it does to not save animals. And so we need to make our mission affordable. And cost is always kind of at the top of our conversations, because without money, we can't save animals. And so we need to save as much money as possible, or just use our resources wisely. Not really save money, but how are we using the funds that we have available? Another thing that I like to think about a lot is thinking of our veterinarians as like Doctors Without Borders. Human doctors are praised for going into other countries and not providing gold standard care, adjusting to what's available at hand to treat people who would otherwise not have access to care. And that to me is just exactly what our shelter veterinarians are doing most of the time. And so I think if we can start thinking of our doctors, of our veterinarians as like human doctors without borders, we can kind of start to better understand what it is they're doing and what it is that is dealt, that's dealt for them. They don't have necessarily all the money to run the diagnostics and provide the best medications and provide that gold standard care. But they're doing amazing work and saving lives with, essentially third country resources and limitations. So I really wish this would kind of get across our country. I think it slowly is, but just recognizing and praising our veterinarians for what they're doing. We have to use our brains and be creative and find solutions. I always think of the puppy that has sarcoptic mange, ringworm, and kennel cough. What do we do with that dog? Where do we house them? How do we care for them? It's zoonotic. Those are pretty big, scary things, but they're all very temporary and not life-threatening. So how do we get creative and find a solution for that puppy? That's the kind of thing that we're always kind of battling, is where do we put this animal that has this unique set of illnesses or disease or whatever it is, and get them to their end adopted home. And we have to work hard and with urgency. It's just not easy what we're doing. It's not easy to work in a shelter, as you guys know. APA does have these core values, which I think are very applicable to our everyday life, and I really, really love them. The first one is innovative. We question everything. Why are we doing this? How can we do it different? How can we do it more efficient? How can we do it more cost effectively? But just in general, why are we doing what we're doing? And sometimes there may be a very good answer, and you're doing whatever it is you're doing with purpose, and there's a reason for it. But what I'm urging you to do is question the things that aren't working for you and why you're doing them, and how you can do it differently or how you can do it better. And that's something that we do often at Austin Pets Alive. We want to be innovative, and we want to be thinking outside the box and working as best we can to save these animals. We want to be inclusive. This is probably the hardest one, because while people are not people are the solution, they can sometimes be the problem. People are, it's not easy to work with others in this space often, because it's very emotional. And it's also very polarizing, right? This is a very polarizing industry. And if we don't align with somebody else that's doing the same work, we tend to, we just don't like them. Or if they don't agree with us, we just, we stop including them in the conversation. And we really want to embrace fosters, adopters, donors, volunteers, even staff. We want to bring them into the fold as closely as possible, because not only do we need them, but we want them to help us. It's easier if, the more people we have, the easier it is. We need to think of it as like building this army of people that can help us care for these animals. We want to be resourceful. Perfect is absolutely the enemy of life-saving. And this kind of goes back to, it's now kind of an old school of thought of like, well, if you can't provide gold standard, you can't do it. It's not ethical to care for these animals if you can't do X, Y, and Z. It's just not accurate or true. At Austin Pets Alive, our building was built in the 1970s. It's very, very old. It's dilapidated. We have lots of issues with it. It's not pretty, but at the end of the day, it serves our purpose. And the animals don't care. They don't care what it looks like. As long as we can provide, adequate housing, provide a sterile surgery field, provide a clean clinic, kind of just all of those basics that, yes, those are the things that you need in place. Whether or not the room is big enough, we can work around that. We can deal with those things that are imperfect, and may make it a little bit harder, but we can still do it and we can still accomplish our goals. So let's get past the fact that we need everything to be a certain way or look a certain way for us to get our mission done. We want to be driven because we need animals every day need our help. It's a problem across the country. It's not just in any one part of the country. There's issues everywhere in our nation. And so we all just need to, be driven and keep in mind that every day that we don't act affects an animal's life that's not that far from us. And then of course we respect life. We treat each animal as an individual. We use a lot of protocols and we'll talk a lot about those. But at the end of the day, those protocols are meant for us to be able to treat animals as individuals when we need to. So this is a little bit unrelated to medical, but still good kind of cornerstones of what our organizations should be striving for. Of course, open adoptions and open foster programs, because people are good and they will do the right thing the vast majority of the time. And so we want people of all walks to be able to volunteer for us, foster for us, adopt from us. We want to be inclusive and make sure that the things that we're asking are relevant to what we're trying to accomplish. This goes back to what we have on our adoption contracts, our foster our foster applications. All of those things do matter because they're all barriers that could potentially prevent an animal from leaving our shelter, which is the exact opposite of our goal. We want as many of them to leave the shelter. And so this is an article link that you guys can check out if you have time. It's really informative and kind of eye-opening. And again, foster is better than being in a shelter. Animals thrive in foster care where they don't in the shelter. Medically, they recover quicker. Behaviorally, we don't see those shelter-induced behaviors that often develop. And it relieves a lot of the burden from us. So let's let them help us get the work done. And again, bring them into the fold and work with them to help us accomplish our goal because they want to help. So let's let them help. We want to welcome volunteers. We need them to support us because we can't, at least most of us, we can't just go out and say, okay, we're going to hire 2 more people today. Or, we've been short staffed, so let's just go ahead and hire 1 more person. It's a little bit harder than that. But what we can do is recruit a volunteer and train them to help us get that work done. And volunteers exist everywhere. And they oftentimes are more dedicated. I hate to say this, but they're sometimes more dedicated than staff. It can be tough to find staff that want to come in and be a kennel tech and clean poop all day long. But a volunteer, it might be a great stress relief from their corporate job or whatever it is. So again, foster trumps shelter. In just about most cases, we want as many animals as possible to be available to go to foster and to even get adopted. We know, again, the goal is to get animals out of the shelter, not hoard them in the shelter. And so having things in place to help these foster homes, things like handouts, training videos, mentor support groups. You can identify, some of your excellent fosters and have them be that mentor if they're willing to. But just looking at different avenues, there's so much information out there now, through Maddie's and just different places that can provide foster support and help you make foster support tools that are, it can be really, it makes it easy. You don't have to start everything from scratch. But we want animals to go into foster and reserve hospitalization for those ones that truly, truly need to be hospitalized. Because having animals unavailable does ultimately hurt us and them. It's not good for anyone. It doesn't benefit. The only thing that it helps with is communicating. It does take time to communicate with fosters, and it does take time to communicate with adopters. But at the end of the day, that time spent is to the benefit of us and the animal. So that's definitely the best route to go. Again, only a small amount of animals that truly, truly should not be available. Maybe it's unclear if they're going to survive, or they have dangerous bite histories. And and you can't find a suitable foster home for them, there's always going to be some animals that need to stay in the shelter, but for the most part, a lot of our animals can be out. So triage medicine, this is kind of our cornerstones of medicine. So we want to do medical make ready as much as possible. How can we minimize delays in treatment? We want to be able to identify illness and start treatment right away. How do we get that treatment started? I would say within the hour. We want to minimize diagnostics, but the reason for this is because we want to save money, because it does save money, but we also want to expedite treatment. Let's take diarrhea, for example. If you see a lot of Giardia in your shelter, you run fecal tests and 3 to 4 times out of 5, it comes back Giardia. Make that your top treatment. So when something, if it's a dog, it presents for Giardia or with diarrhea, treat it for the Giardia and then go from there. Create a protocol around that, but treat for the top thing first, that it most likely is going to be per your area, and go from there. It expedites treatment and it's cheaper. You want to prevent disease. This is a huge one. You've got to vaccinate everything. Anything sick, injured, coming through the door, it's got to be vaccinated. If not, you're going to see a disease outbreak at some point. I could almost guarantee you that. And you need to train all staff on relevant diseases in your area. Not just medical staff. You want to make sure everybody stepping foot on campus can identify, at least within reason, parvo. If you see it in again, this is going to be depending on where you are in the country. Whatever you see commonly, they should be able to identify and at least bring it to the clinic's attention. Specialty programs, again, depending on where you are. For us in Texas, things like parvo, calicium, we have protocoled those treatments, and so now we can treat effectively, efficiently, and cost effectively as well, and get those serious diseases, get those animals treated, and without a lot of panic or delays in treatment. And then protocols will also fight with infighting. If I'm arguing as clinic manager, if I'm arguing with our cat program manager on how we're going to house this one particular cat, a lot of times we can just build that into the protocol so that, I'm not having to go back and forth with anybody else. It's already built into the protocol. We've agreed upon it ahead of time. And so it just makes everything a lot easier. Again, we strive to do what the average pet owner of average means can afford, because we know there's a whole spectrum of what pet owners can afford, right? And we kind of just want to fall right smack in the middle of that. We need to triage, because our vet time is expensive and extremely valuable. We don't have enough veterinarians. Maybe someday we will, but currently we do not have enough veterinarians. None of us probably do. And so we need to train our clinic staff and technicians to follow some of those protocols for common illnesses that we see, so that we can elevate the animals that truly need to see a veterinarian and have that time. Our vets can actually do that, and they're not slipping through the cracks, or we're not providing substandard care. I always think of it as vets just spinning their wheels, treating, upper respiratory, diarrhea, all these things that don't tend to be, sometimes they can be very serious, absolutely. But a lot of times, these are very common things that we treat with the same medications over and over. So let's put that in our technician's wheel, and then the vets are seeing the complicated cases, or those cases that are dropping out of protocols that aren't falling into the protocol. And we want to treat as much as possible in-house, again, just to save money. It tends to be more expeditious and it's cost effective. And then again, when our resources expand, we are going to expand the number of lives we save, not necessarily the money we spend on each one. So again, the goal is to save as many animals as possible. And so if we get extra funding for something, we don't necessarily, sometimes we do, but we don't necessarily always want to be okay, great. So now we're going to be able to do respiratory PCRs on everybody. Like that's just not something that's in Texas probably ever going to be a smart thing to do. But we definitely want to increase the number of lives that we save. And then kind of rule of thumb is equal treatment for all animals is the goal, or at least one of the goals. We want to standardize care and not, it's easy to fall in love with one animal or to really be, pulled to one animal and want to do everything for them. But that oftentimes leaves other animals not receiving that same care. And so we really wanted to standardize across the board how we treat patients. Of course, we treat animals as individuals when we need to, but the only way that we can do that efficiently is if we can standardize as much as possible. And so if we find ourselves wanting to do something for one animal with a condition, then we really need to find a way to be able to do it for all of those animals with that condition. Okay, that is it. Thank you so much. Again, I'm looking forward to the class with you guys, February 2nd through 23rd, Thursdays at 6 p.m. Eastern Standard Time. If you have any questions between now and then, please shoot me an email or a text or a call. And again, I look forward to meeting everybody. I hope that was a little bit helpful, kind of a window into the things that we'll be discussing. So get your questions ready, and I look forward to meeting everybody. Thank you.